Okay, I get to use a little bit of what everybody talked about. I appreciate that opportunity. Again, my name is Saadi. I'm the president of NAPHSIS and state registrar for the state of Kansas. And I really appreciate what you said about our statistics tell stories. One of my taglines for my bureau is that we're seeing people in the numbers, and it's really important for us to understand that. There are people in the numbers. What you've heard is information is presented to you related to how the data gets used, how we collect it, but what I want to share with you are some salient points about our vital statistics system. And the reason we're here with you today is to try to get you some information to help us understand and how we can understand what happens with what we do in our work, and to help us do better at communicating and educating and informing and empowering people on using our information. There are thousands of us in the vital statistics system in the states at the local levels collecting this data for you. We have a civil registration system that was established in the early 1900s for our citizenry, and it's evolved into a very robust public health information system. That hasn't happened magically. It has, frankly, been the work of maternal and child health directors and those who are doing research and evaluating the state of maternal and child health in this country that really pushed the envelope and assuring that we get good information from our birth and death systems. We are, I will say, at the mercy of those that report the data to us. Don't want to scare anybody, those of you that use our information, but we struggle daily to acquire this information from physicians who sign death certificates, from birth clerks who fill out the birth certificates for us. We're at their mercy to give us the best information that we can get. We struggle every day with coroners that, in particular, I'll just talk about Kansas, and I know these are not unique stories. I've got a coroner who says, I don't want to provide you opioid or drug information on the death certificate. I don't work for the government, although he takes a check from the county government, but I'm interested in preserving the interests of the family. They don't want to see all those drugs on the death certificate. That's a problem, and that's something we have to do to improve that situation, because as we know, if we don't have the drugs on the death certificate, we really don't have good information about how people are dying. The maternal mortality program and the projects that are underway to improve our information, like Devin spoke about, the information that's collected, pregnancy checkbox or whatever mechanism we use, it is so critical. It's a shame for us to have maternal mortality in this country. It's a sentinel failure of public health to have maternal deaths. And I have to say again, our maternal and child health directors and their partners with, like March of Dimes, and the researchers with the fetal maternal fetal and maternal medicine groups, they're critical for us to be able to demonstrate the problems that we're seeing. But those of us at this level, the level of us in the vital statistics, vital records area, the missing thing sometimes that we don't see is we know our data gets used, we hope our data gets used, but we don't really have those pearls where we can actually say that our data was used to actually pass legislation. We know our data saves lives, we know our data gets used to educate physicians on how to do things better, but we don't really, that doesn't come back to us very, very readily. And it's very painful for us to understand, to grab at those and try to use those to promote improvements in the vital records, vital statistics system. And we're at a level where we need that assistance from all levels of our government, because we know all levels of government are using our information. Let me just share a couple of examples where, and we're talking the last 10 years, some of these things that have evolved for Kansas. And Kansas, the most crimson of states. I'm just saying it's crimson, not just red. It's really bleeding. Whereas there's just a huge dislike for mandate, like a lot of states have. It's an evil, dirty word, but sometimes you can overcome those kinds of impressions. So I've been in this position, or at least at the State Health Department, for 30 years. I've seen maternal and child health directors come and go. I've seen varying levels of working together with the partnerships with our coalitions, et cetera. And so we have one now that is really outstanding. And when that person first came to be with our agency, she was actually getting her master's degree in early childhood education, but she was also working in the child care arena. And she noticed, and we shared data with her, that children were dying in unregulated child care facilities, child care homes at a huge rate. Inspected, licensed child care centers had 0 deaths. It's unacceptable for us to have that. So she went to work working with her champions. Unfortunately, the champion that helped us work on this issue had a child that was lost and had died in a home daycare. It was very unfortunate because you know, you have legislators that make comments like, well, the numbers aren't that high. That poor woman that had to testify pretty much said, well, what it was, if it were your child or grandchild that died, is that a number enough for you? Luckily, they were able to pass legislation, and again, they used our data to help forward this conversation to be able to get all home daycares licensed and inspected by the state. Now, East Coast, West Coast, that might not be a big thing, but for us it was a huge thing, because you're really trying to manage the forces of mom and apple pie, the safety of your children with the right to own a business and manage that business unfettered. And that's really huge for a lot of our red states. But we were able to overcome and prevail in assuring that the safety of children was much more important. Subsequently, this same maternal and child health director, along with her partners, was able to push statutory requirements for safe sleep. We still had daycare providers putting children on water beds, totally not allowed. Children suffocating, etc. That provision was put into statute, not regulation. So it is a huge change and improvement for us. And then finally, after educating our legislators, we've got a full maternal mortality review process put together, and we appreciate the work of the March of Dimes to help us get that. That required physicians to actually provide information to us about those. That was that was a heavy lift for us, because physicians don't want you looking at what's being done. But at least we were able to prevail on that and get that particular piece of legislation passed. So that's the public policy side, the state government side, where we're able to capture the information and that's used to forward public policy. We have also participated, and I want to see more of this happen, where we have linked our birth data, for example, with data from a private employer. That employer paid a vendor extra money to assure that good prenatal care was given to their employees. Once we worked through all the confidentiality issues, because my goal was to make sure that they couldn't pinpoint a particular employee for whatever they would like to pick on them about. Once we got that put together, they were able to see that some of the prenatal care provisions that the vendor was on the hook for didn't happen. They had some moms smoking. They had some moms not following up with their appointments like they paid extra to have done. So they used that information, I'm sure, in their contracting process later. But at least it showed them that there is data there that can be used to improve the care that they pay for. So you've heard about some of our improvements that we've made in the timeliness. We're definitely working on quality to improve the vital statistics system, but we still are going to need your help in educating our legislators, our congressmen, whoever will listen to us, to forward some of the needs that we have to continue to improve the vital statistics system. There's a lot of opportunity through the high-tech provisions with now electronic health records that are in facilities now. A lot of projects are underway through the National Center for Health Statistics and other entities to try to acquire this information, pull it out using the technology from electronic health records to make the information richer and more relevant. But states can't manage the funding for some of that. We're going to need your help to help us understand, to help us acquire those resources at some point. The other thing that we're going to be needing, and it's really difficult for us to do, is to understand what kinds of ways we can share information with our policymakers. They're over-communicated to. They probably get lost in the amount of information that's provided to them. How do we punch through with making information that really captures their attention? We're developing systems now that we could be able to merge data, link data, GIS it to death, however you want to do. We've even produced some statistics by legislative district. So if they're going to make a decision on Medicaid policy in their particular district, they can see how many moms they're affecting or who they're affecting. That kind of level of very personal information, I think, can be powerful. But we need some help in communicating that, and we need to understand what works. And that's what doesn't get filtered back to us. As was mentioned with Becky and Dr. Lewis, you know, there are a lot of data geeks out there. We're in that world, but to pull it up to a higher level and understand what you would need to actually communicate, to develop knowledge that will improve our health and save lives, we need your help to help us understand that. So in closing, we want to thank you for all the work that you're doing to help us understand better and to use our information, use our data. You've seen all these tools that are available. Please do that, but also let us know. NAPHSIS is available, any of us in our jurisdictions. If you need your birth certificate, call up and say, thanks for doing what you do. We need to hear that, and it's certainly a community that's ready to help make sure that we keep our citizenry healthy and our information flowing. So anyway, thank you.